We are so excited to be here today at the Health 2.0 Conference 2023 in Las Vegas, Nevada. Please introduce yourself and the organization you're representing today.
Hi, well, first of all, it's great to be here, Amy. I appreciate you having me. My name is Rick Johnson, and I am the Vice President of Commercial Healthcare for MarketCase. So recently started this job and really excited about it.
Amazing. So you are a Health 2.0 Conference, also a Marketing 2.0 Conference honoree. How does it feel to receive recognition for your accomplishments? And not just one, but 2 awards.
Well, honestly, Amy, I'm humbled that my work was recognized. But the other thing I need to say is, nobody succeeds without a good team. So I'm so thankful that I've been truly blessed with wonderful teams at the different places where I've had a chance to work. So a real thank you to them as well.
Absolutely. So you touched on the problem with patients being adherent in medical in your panel discussion. How big of a problem is that?
Sure. So just for context, roughly 65% of Americans who have some sort of health condition take medication for that condition. And when we talk to those people, we found that roughly 36% of them told us that they either thought that being adherent to their medication, they were neutral on it, or that it didn't matter to them. And, you might say, oh, okay, well, so what? Something else we found that was really interesting was when we talked to healthcare professionals, they almost had the same levels of, feeling it wasn't important for their patients to be adherent to medication. So that was honestly kind of shocking. But to get back to your original question of how big a problem is it? The Annals of Internal Medicine did a study and found that there's 125,000 Americans that die every year because they're not adherent to their medication. And in terms of impact to our healthcare system, it's costing us somewhere between $100 and $289 billion because people are not adherent to their medication regimes. So obviously it's a very serious issue.
Definitely sounds like it. So what can we do about non-adherent to medication?
That's a great question. And I would say there's probably 3 things that we could really do. The first is we need to get medication into more people's hands so that they can take it. Mm-hmm. And when we talk to people who take medication and we ask them, what are the barriers that you have to actually being adherent? We found that roughly 31% of people said not having access to their own drug plan was a barrier. And then related to that, roughly 42% of people said the cost of medication is too high. So trying to figure out how we can get medication into people's hands. Another thing we need to do, the second thing is when we look at the density of pharmacies in this country, roughly 3 in 4 Americans is within 2 miles of a pharmacy. But we found out that 21% of people say that not having access to a pharmacy that's close to them is problematic and is a barrier. So we need to do more to try to understand why is the density of pharmacies not impacting this hurdle for people.
Absolutely.
And then the third thing and last thing I would say is education. So we have quite a few people who have told us that the side effects, I think it's about 56% said the side effects that they have from medication, that is so undesirable that they don't want to take their medication anymore. And then on the other side of that, we found out that almost a quarter of people said, well, I don't feel like I have any symptoms anymore, so then I'm not going to take my medication. But of course, that's a little bit of a vicious cycle because they probably don't feel like they have those symptoms because they have been taking their medication.
Right.
So again, education on the part of healthcare professionals and the pharmaceutical companies, I think would go a long way for that third piece.
Absolutely. Well, it's been a pleasure talking with you today. Thank you so much for your time.
Thank you, Amy. Appreciate it.